Hi, thank you for tuning in for our free bloodborne pathogens training. At the end of the training, you can take a short quiz and then you are eligible for a certificate for bloodborne pathogens. This is presented to you through Train Your Brain, and I am Coach Flowers. We're going to switch over here to my Ed app, Introduction to Bloodborne Pathogens. Okay, let's go. What are bloodborne pathogens? Bloodborne pathogens are microorganisms that can be present in in human blood and can cause diseases in humans. Examples of bloodborne pathogens include hepatitis B, hepatitis C, and human immunodeficiency virus. These pathogens can be transmitted through contact with infected blood or other bodily fluids. Risk and transmission. Child care workers may come into contact with blood or other potentially infectious material while providing care to children. The main routes of transmission for bloodborne pathogens include direct contact with blood or bodily fluids, needle stick injuries, and contact with contaminated surfaces or objects. It is important to follow proper hygiene practices such as hand washing and wearing gloves to minimize the risk of transmission. Prevention measures. Child care workers should receive training on bloodborne pathogens, safety, and follow standard precautions to prevent the spread of infections. Standard precautions include using personal protection equipment, PPE, like gloves and aprons, properly disposing of contaminated materials, and practicing good hand hygiene. Wallaby says, be well, be clean, wash your hands. Child care facilities should have policies and procedures in place to address bloodborne pathogens, safety, and provide necessary resources for staff. Handling injuries and exposures. In the event of an injury or exposure to blood or bodily fluids, immediate action should be taken. Wash the affected area with soap and water and report the incident to a supervisor or designated person. Follow the facility's protocol for seeking medical evaluation and treatment, including testing for bloodborne pathogens if necessary. Cleaning and disinfection. Proper cleaning and disinfection practices are essential to prevent the spread of bloodborne pathogens. Use EPA-approved disinfectants to clean surfaces and toys that may have come into contact with blood or bodily fluids. Follow the manufacturer's instructions for proper use and contact time of the disinfectant. So this is important in your classroom. If you have a toy that has been mouthed by a child, that you may have some type of yuck bucket or a place for mouth toys to go out of circulation until they're properly sanitized and disinfected. Waste disposal. Dispose of contaminated materials such as gloves, tissues, and bandages in designated biohazard waste containers. Make sure the containers are properly labeled and securely closed to prevent accidental exposure. Follow your local regulation guidelines for safe disposal of biohazard waste. As we know in childcare, many times you may not have an actual container labeled biohazard, but it is common that you would bag that glove, tissues, bandages, or diapers in its own individual bag that you would securely knot, and then you would place it in a closed garbage can that is hands-free. Vaccination and immunization. Child care workers should ensure they are up to date with vaccinations, including hepatitis B vaccine. Hepatitis B vaccine is highly recommended for all healthcare and child care workers. Vaccinations can provide protection against hepatitis B, reducing the risk of infection. Education and communication. Educate children and parents about basic hygiene practices such as hand washing and covering coughs and sneezes. Promote open communication with parents and staff about any potential exposure incidents or concerns. Regularly review and update bloodborne pathogen safety policies and procedures to ensure they are effective and relevant. Let's check your understanding. What are bloodborne pathogens? A, microorganisms that can cause disease in humans through contact with contaminated surfaces or objects. B, microorganisms that can cause diseases in humans through respiratory droplets. C, microorganisms that can cause disease in humans through contact with infected blood or bodily fluids. D, microorganisms that can cause diseases in animals through contact with infected blood or bodily fluids. If you said C, microorganisms that can cause diseases in humans through contact with infected blood or bodily fluids, you are correct. How can bloodborne pathogens be transmitted? A, contact with infected animals or insects. B, ingestion of contaminated food or water. C, direct contact with infected blood or bodily fluids, needle stick injuries, and contact with contaminated surface or objects. Or D, inhalation of respiratory droplets from an infected person. If you said C, that's correct. Direct contact with infected body, blood, or body fluids, needle stick injuries, and contact with contaminated surface and objects. All right. What are standard precautions for preventing the spread of bloodborne pathogens? A, avoiding contact with children who have visible signs of illness. B, administering vaccines to all children in the child care facility. Or C, using personal protective equipment, PPE, properly disposing of contaminated materials, and practicing good hand hygiene. If you said C, using PPE, properly disposing of contaminated materials, and practicing good hygiene, that is correct. What should be done in the event of an injury or exposure to blood or bodily fluids? A, ignore the incident if there are no visible signs of infection. B, wash the affected area with soap and water and report the incident to a supervisor or designated person. C, seek immediate medical attention and start taking antibiotics. Or D, apply a bandage to the affected area and continue with childcare duties. If you said B, wash the affected area with soap and water and report the incident to a supervisor or designated person, that is correct. How should surfaces and toys be cleaned to prevent the spread of bloodborne pathogens? A, wipe surfaces and toys with a damp cloth of water. B, use EPA-approved disinfectants and follow the manufacturer's instructions for proper use and contact time. C, boil surfaces and toys in hot water for thorough cleaning. Or D, use regular household cleaning products without specific disinfectant properties. If you said B, use approved disinfectants and follow the manufacturer's instructions for proper use and contact time, you are correct. You have completed this lesson. If you want the certificate, please complete our short quiz at the end.